Every August, I go to Dr. Corley, who's my PCP, for my annual exam, and felt great. I had just finished up a job, starting a new hospice in downtown Atlanta. I was very invigorated. We had our renewal of our vows, so it was, August. I was real excited and went in and saw her, and everything was very routine. Blood work was fine, did all the usual things. And as she was leaving, she said, anything at all, Cheryl, unusual? And I said, yeah, I actually had in July some vaginal bleeding. And I said, my best friend is all over me to tell you about it. I said, thank God you said something, because I forgot. And she stopped immediately, closed the door. She came back in. She said, we're going to look into that. You're 20 years, postmenopausal. She said, this is significant. I'm going to have you see somebody. We're going to do some testing. And thank God, it was kind of an afterthought for me, but those little things really matter, because it ended up contributing completely to my diagnosis, and a quick diagnosis and intervention. When I saw Dr. Green at that first initial visit, he had asked me, as I said before, what would be my expectation. And I said, well, I need to know a few things. I said, I need to know, should I go to MD Anderson? I said, that's the best cancer hospital that I know of, and many of my patients have gone to. And he said, you could. He never said don't go, but he said you could. He said, but Cheryl, I'm going to tell you something. The protocol they follow is exactly the protocol I follow. He said, he turned around in his chair and he pulled up on the screen MD Anderson's protocol and Northeast Georgia's protocol. And he said, let's look at them. I actually moved around, and we did. I did a comparison of scanning, because immediately you're thinking, okay, Northeast Georgia, are they as well equipped? Are they as knowledgeable as an MD Anderson? It showed me we were, that I completely was in the right place and with the right system. Surgery was the easiest surgery I've ever had. I've had 3 C-sections. I've had kidney stones. I've had a complete Achilles tendon and foot repair. I can honestly tell you, robotic surgery, I will tell anyone. In fact, my husband just had it a month ago. I will tell anyone to explore that option if they can. Dr. Green provided me a lot of education about it, to the point in the operating room showing me this machine and, again, walking me through exactly how the procedure would go. Through it all, that was what I really admired, that I felt like I knew exactly what was going to happen to me and how it was going to go. There were no surprises, none at all. I would like to say to Dr. Green and to the team, everyone was wonderful that I worked with, but their honesty, their integrity, letting me know that every step of the way they were there, never losing patience with me or Julie or my husband. That was wonderful, and for them to continue their work. Their endeavors are so successful, and I appreciate them.